Angela Brown, Unit 4, Journal Assignment. So this week, what I found interesting, I don't have nothing I can prop this on, so I have to hold it. I seen a 8-year-old patient in clinical, and what I was surprised about was the fact that so first of all, the child was diagnosed with, let me pull him up. He was diagnosed with autistic disorder, F840, pervasive development disorder, unspecified, F849, and ADHD combined type, F902. So he came in with the classic clinical signs of autism, and so I've seen it one time in family. I've seen an older child come in with autism. Now, I do have a family member who was diagnosed with autism, so I'm kind of familiar with how they act, their symptoms or whatnot, and I just had never seen one around her age, of the family member's age. I think she's like 6, and this patient was about 8, and so she is being treated with cataphrase, and so I've seen that in the past when I worked in a pediatric clinic. When I went to pediatric clinicals in the family nurse practitioner program. So I've seen a lot of children getting treated with that, with autism with cataphrase. Even children with just ADHD, I've seen the cataphrase used. But what I did not see is Vyvanse. This child was treated with Vyvanse, and I've never seen that before. I didn't even know. I mean, I'm sure more research, I would learn that children can be treated with Vyvanse. Let me see, medication list. So the patient was taking 40 milligrams of Vyvanse, 1 capsule by mouth in the morning, and also the clonidine, 0.1 clonidine cataphrase, 0.1 milligram tablet by mouth. Take 1 3 times a day, and 3 at bedtime. I've never seen it written like that. So it's interesting that these how to treat one person may be a lot different than the next person, as far as the schedule and when they take their medication. I've never seen it written like this either. So the mother was stating that she did not want the child on Vyvanse. Her and the father was there, including the older brother was at the visit, and they were saying that the child, the 8-year-old patient, he took the Vyvanse one time and he was up for 3 days. And they said, in addition to that, he was very violent, and they stated that he was, what else? He just was a different person. And so she said that she liked him better on the cataphrase, and she wanted to DC the Vyvanse and continue with the cataphrase. So that's what we did, and so he is scheduled to come back in 2 weeks. So I'm hoping that I am there to see him to see how he's doing with just the catapress. They also mentioned that he only took it one time, and so they didn't give it to him anymore. And then after that, usually before he started the Vyvanse, he would sleep throughout the day. Once he go to sleep, he'd sleep through the night. But once they started when they stopped the Vyvanse and he was still taking the catapress, he would sleep, but he would wake up at least one time in the middle of the night and find his mom, and then maybe go back to sleep once he found her, go to sleep on the couch or something. But he used to sleep throughout the night. So the doctor didn't want to make any changes as far as increasing the dosage just because of that. He will reevaluate when he returns in 2 weeks. So that was a very interesting case for me and learning experience as far as my role as a psychiatric mental health nurse practitioner. And so my strength is always, when I don't know something, to continue researching, continue learning. And I learned some medication administration and side effects and things like that, seeing that patient. And that is it. Thank you. Okay. I have to keep smiling until it goes off.